What is fibromyalgia? The literal meaning is pain in the muscles and fibrous connective tissues. For many years, doctors refused to acknowledge its existence. Fibromyalgia sufferers were often told everything is in your head and sent off for psychiatric pain medications and antidepressants without any real significant help for their condition. I'm here to tell you that fibromyalgia is real and it can be severe and disabling. It is a complex health problem and it requires a complex, in-depth approach. The treat the whole person concept has never been more on target for what is required to conquer this serious and complex health problem. To further complicate things, fibromyalgia sufferers often have a wide range of other symptoms associated with their illness. Some of these are sleep disturbances, flu-like symptoms, abdominal discomfort and digestive disturbances, numbness and or tingling in the arms, legs, hands, and feet, constipation, cognitive disorders, visual disturbances with or without nausea and dizziness, depression, chronic fatigue, body stiffness, irritable bowel syndrome, leaky gut syndrome or increased intestinal permeability, chest pain at the costo-sternal junction, sensitivity to light, noise, and odors, irritable bladder and or frequent urination, and anxiety. So, you have fibromyalgia and probably some of the other symptoms that are often present along with fibromyalgia. But how did this happen to you? What could have caused it? The causes can be many and complex, but for the sake of simplicity, there are 4 categories. Number 1, chemical causes. 2, physical causes. 3, emotional causes. And 4, trauma or injury. Trauma or injury causes a decrease in the brain's frequency of firing. Within these 4 categories, things like physical stress, inadequate sleep, exposure to cold and dampness, people with autoimmune problems, toxin exposure, hormone imbalances, mental stress, injury, following infections, chronic inflammation, and neurotrauma imbalances in the brain can cause fibromyalgia. In clinical practice, it is common to find that there are multiple causes in each case. The autoimmune component is a common cause or significant contributing factor in fibromyalgia. Some examples of this are the thyroid. 75% of fibromyalgia sufferers have low thyroid function. 90% of these are autoimmune thyroid dysfunction like Hashimoto's thyroiditis. Increased intestinal permeability or leaky gut syndrome. Food allergies and sensitivities because abnormal antibodies are produced. Gluten sensitivity or intolerance because abnormal antibodies are produced. And other immune system dysfunctions like candida. It is an absolute must to address immune system balance and dysfunction in fibromyalgia sufferers. Whole body inflammation is a significant factor in fibromyalgia. Chronic inflammation worsens fibromyalgia and slowly causes tissue destruction. We use lab tests to check for whole body inflammation at our clinic. Hormones, or more correctly, hormones that are unbalanced, are frequently a problem in fibromyalgia patients. Hormones affect every cell of every tissue in your body. It is essential for the fibromyalgia sufferer to have proper hormone balance. Now, we're going to talk about the brain and nervous system and its importance in fibromyalgia patients. The brain sends signals through the brainstem and down the spinal cord. This, quote, nerve energy flows to all of the vital organs, tissues, and cells of our bodies. Each cell of our body is totally dependent upon that energy to stay alive, healthy, and functioning properly. In normal brain function, the cerebellum receives nerve input from your body and then sends the nerve signals to the frontal lobes of your brain. The frontal lobes are then able to send sufficient nerve signal input to the lower brainstem, which keeps the mesencephalon portion of the brain from overfiring. In fibromyalgia, there is often abnormal brain function. If one side of the cerebellum is not receiving the proper amount of nerve input, it cannot send the proper amount of nerve input to the frontal lobe of the brain. The frontal lobes of the brain then cannot send the proper amount of nerve input to the lower brainstem, which will not be able to keep the mesencephalon from overfiring. Some of the symptoms that can result from a disruption in the brain's electrical vitality, or put another way, a brain imbalance resulting in an overactive upper brainstem or mesencephalon, are chronic pain, light sensitivity, blurred vision, difficulty falling asleep or staying asleep, irritable bowel syndrome, high blood pressure, flu-like symptoms, chronic fatigue, migraine headaches, increased sweating, heart palpitations and or increased heart rate, urinary tract problems, and fibrofog. Brain malfunction can also give fibromyalgia sufferers other difficulties, such as episodes of depression or anxiety, difficulty adding and subtracting, difficulty understanding what others say to you, a loss of sensation or numbness, more irritable or angry episodes, learning disabilities, ADD, difficulty scanning pages while reading, difficulty expressing what you want to say, loss of short or long-term memory, changes in your handwriting, problems with balance, tripping or dropping things, dyslexia, and ADHD. For effective treatment of fibromyalgia, you must correct both the brain misfiring and the metabolic dysfunctions. For the fibromyalgia sufferer to regain their health, all of the pieces have to be brought together and the whole person treated. To summarize, in fibromyalgia, we usually find neurotransmitter imbalance. Neurotransmitter imbalance must be identified and corrected. Usually, there is an abnormal neural firing pattern in the brain. A neurological exam can identify this. Abnormal brain firing patterns are treated using methods such as vibration therapy, music therapy, laser therapy, warm calorics, and olfactory stimulation. Hormone imbalances must be identified and corrected, and immune system dysfunctions must also be identified and corrected. What we do at New Life Anti-Aging Clinic that's different, we do an exam, both physical and neurological. We do extensive laboratory testing. We check red and white blood cells. We check the body for inflammation. We check the thyroid and thyroid antibodies. We check the immune system for dysfunction. We check for gluten sensitivities or intolerances. We check for heavy metal toxicity. We do comprehensive metabolic profiles. We check hormones for balance. We check adrenal function. We check for food allergies or sensitivities, and we do a neurotransmitter assessment. All of these findings are correlated, and a specific treatment plan is devised for that person. The goal of this comprehensive patient-specific treatment plan is to correct the underlying causes of the fibromyalgia and return the person to health. What would it be worth to you to get your life back? What would you like to feel normal again? Would you like to have more energy, sleep better, have less pain, have less fatigue, less depression, and have fewer and less headaches? What would you like to be there for your family again? Well, my name is Dr. Richard M. Thomas. I am board certified in anti-aging medicine, and I have helped many people just like you. People turn to doctors who have been trained in anti-aging medicine and functional medicine when their situation seems hopeless.